Hi, everybody, and welcome to tonight's video webinar series. My name is Dr. Jeffrey Puglisi. I'm a concierge internal medicine doctor out of Greenwich, Connecticut, and I've been doing that for the past 19 years. I'm also a member of the CR&T Cancer Research and Treatment Fund board for the past year because I myself have an MPN cancer called polycythemia vera that was diagnosed a couple of years ago, and I get my care down at Weill Cornell, and we'll meet some of the doctors that I've been lucky enough and fortunate enough to work with over the past couple of years. Tonight's event is funded by the CR&T board. I want to thank Dr. Richard Silver, Tom Silver, Barbara Rosenstein, who does everything behind the scenes to get all this prepared for us, to David Boulay, who has really curated a lot of the questions that we're going to ask our expert members tonight on the panel. And tonight's program is really entitled MPN Cancers and Mental Health. And it's a topic that doesn't get enough conversation recently, and it certainly should, as it relates to the last 12 months, where we've been really dealing with a lot of isolation and stress, anxiety, depression, and that's even patients without MPN cancers. Can you imagine what all of us have been going through, and the treatment and the diagnoses and everything that goes with it? So I think this is a germane conversation to have tonight, and hopefully it opens discussion that you have with your physicians going forward. So at this point, I'd like to introduce our two experts in our conversation this evening on tonight's webinar. First, I'm going to introduce Dr. Guy Maytal. He's an assistant professor of clinical psychiatry, and he's the chief of integrated care and psycho-oncology at Weill Cornell Medicine in New York City. Guy, thanks for being here tonight. We really appreciate it.
Pleasure to be here. Thank you, Jeff.
Yeah, sure. And also to Dr. Ghaith Abu-Zeinah, who's an instructor in medicine at Weill Cornell. He is both a clinician and a researcher, hematologist-oncologist that treats patients with MPN, and he's a member of the CR&T's Medical Advisory Board. Guy, thank you so much for joining us tonight, and I really enjoy having you on these webinars that we've done.
Thank you, Jeff. It's a pleasure to be here again.
Fantastic. So we're going to dive right into some questions. These are questions that a lot of patients have asked us in the MPN community, and we really appreciate the input that we get at the end of the program. We'll give information on how individuals can reach out to us or to the CR&T Fund. We do a lot of educational events throughout the past year, particularly since we can't be in person. And we really would like to get feedback from you. And the more individuals that join the fight, the better we're going to be in terms of curing these cancers in the future. I'm going to start, in case people are a little unaware of what MPN cancers are, just to go to Dr. Abu-Zeinah. Guy, if you could just take a minute or two to talk about MPNs and your role in taking care of those patients, if you don't mind.
Of course. So myeloproliferative neoplasms are cancers of the blood and the bone marrow that lead to abnormal blood cell production, a variety of significant symptoms, sometimes debilitating symptoms, and complications such as blood clots, bleeding, and even leukemia. MPNs are unique for many reasons. One being that they are malignant cancers, but they have a chronic course that can range from several years to several decades before it becomes a major problem. In fact, years ago, they were referred to as chronic myeloproliferative disorders. The word neoplasm, which means cancer, was not part of the terminology until relatively recently. When the WHO revised the diagnostic criteria in 2008, the term neoplasm was incorporated to highlight the cancer biology that drives these diseases. The terminology itself can be intimidating, and even though many years can go by without any disease-related complications, patients are often anxious during these many years.
So, Guy, that's exactly the reason why I think a lot of patients are so stressed out about these diseases, is because whenever you put the cancer term next to a medical problem, it certainly spikes the fear level in patients. And I'm going to go to Dr. Maytal for a second, if you don't mind. Guy, one of the questions that an MPN patient asked us was, as a patient, I feel uncomfortable sharing with my friends and family, particularly my children, that I have a blood or bone marrow cancer. How should I broach this topic with them? And is it possible for me to get beyond this level of discomfort?
It's a really broad question, and I think a very challenging one, precisely for the reason you just raised, because it's hard to know what you're you know what you're saying, but it's hard to know what's being heard. Because like you said, the moment you say the word cancer, people have all sorts of automatic responses to it. mostly something in the domain of when you're going to die. Because death is right there whenever the word cancer shows up, and it's automatic, it's cultural. It's actually pretty much across all cultures. When you say cancer, people hear death. So I think part of the discomfort in talking about MPNs is because there is such a diversity of courses and such uncertainty about the course of it. So the first thing is I would be curious as to why this particular individual or why people are uncomfortable talking about it. Probably because of something to do with what I just said, but I'd be curious to hear your thoughts on that, Jeff. Because, if you were diagnosed with diabetes, which is a chronic illness that requires intensive management over a lifetime, and when not done so, certainly decreases your lifespan, there isn't the same degree of embarrassment or discomfort, but maybe there is. I think part of the challenge is, especially for one's children, because the moment you say cancer, especially if a child is above a certain age, I don't mean 3, maybe somewhere in their early adolescence, they'll go online, they'll Google it, they'll figure this out, they'll be scared and worried. So I think it really depends on your relationship with them, the degree of understanding. One of the things that is really important when you're talking to children is to reassure them, but not feed them a line. You tell them what you know. You tell them what you're doing. You tell them what you're doing to take care of yourself. And especially kids are worried about 2 things. One is, will you be there to take care of me? And 2, did I do something wrong? So those are, because, children are, I could say this about all people, but children in particular, they're all about themselves because they're worried about their own survival, growth, development. The adult is an interesting appendage that's there to provide stuff for them until you get to become an adult yourself and you maybe develop an appreciation for your parents. So the discomfort may or may not go away. The question is, are you going to have the conversation and be uncomfortable, or not have the conversation and be uncomfortable?
That's a great point. I think personally for me, it was interesting. It wasn't so much about family and friends as it was about patients. I've been a physician for nearly 20 years. And I think that when you let patients into your own medical struggle, I think you have to do it with the idea that you're sharing something with them so they understand that you're going through medical issues in the same way that they are. And I think it can actually bring you closer together. And I would say the same for family and friends, is that once you get beyond the cancer conversation and you can explain this a little more broadly, and Ghaith and I have talked about this a lot in the past, is that once you understand that this is a disease and a cancer that has peaks and valleys, and hopefully over a long period of time, that I think that you can usually explain it to them so it decreases the level of anxiety, and it gets them from thinking about friends and family and colleagues that have passed away very quickly from cancer. And I've said in previous webinars that each one of us is directly affected by cancer. There's just no doubt about it, whether it's a family member, friend, colleague, etc. We're all touched by it at some point, whether personally, individually, or with someone that we love. And I think the more that we have conversations about it, the less of a stigma that it has. And it's interesting, tonight, we're talking about stigmas of mental health, right? And Guy, you talk about this a lot as it relates to the inability of a patient to actually seek care because of that stigma. I think the same thing can be said of cancer patients too.
Yeah, I agree.
Ghaith, I'm going to ask you a quick question, Dr. Abu-Zeinah, from a patient that we know well. And their question is, am I unusual if I feel anxious and fearful about whether my MPN cancer will progress in the future? It seems with each lab test, every bone marrow biopsy, I have extreme stress that my disease may be currently getting worse, even if I don't feel terrible at that particular time. How should I deal with that stress, and what coping skills could help me get through that process, since that's something that I'm going to live almost every month and every year going forward?
That's a very good question, because it applies to almost every visit a patient comes to see me. Not that I do bone marrows in every visit, but we certainly do blood tests, and we have these conversations every time. I think it is in our nature to be anxious or fearful of the things that we feel we have little control over, even when things are in fact potentially under control. The opposite of that, I think, would be overconfidence. I think it is extremely important for us to spend time with our patients trying to understand what their perception of their disease is at any given time. There's often a dissociation, in my opinion, and I think this has been studied and there's literature on this, that there's a dissociation between the physician's perception and the patient's perception. In fact, there's published evidence even in the MPN literature about this. And so it's very important for both the patient and the physician to be on the same page in terms of expectations and goals of treatment. Of course, there will always be some level of anxiety when it comes to our health and longevity. So, what else can we do about it? I do think number one is we have to make sure we're on the same page and we're sort of speaking the same language. The other things we can do about it, I think the first step is really admitting or accepting that we are anxious and stressed, both to oneself and to our social support system, partners, family, friends, and our healthcare team. Physicians should ask their patients about their level of anxiety, stress, or depression. Really ask about their mental well-being, even if a patient doesn't volunteer that information, and especially when patients don't volunteer that information. I think this collaboration with the patient's social support system and healthcare circles really is important to help identify ways to improve and maintain the patient's mental health. Finally, of course, I think there are several coping mechanisms that I feel are really individualized to the patient. To me, at least, and I'm not a psychiatrist, but I think one question I would ask my patient is, what is something you enjoy doing? What is something that you feel you have control over, and restores that balance where if you feel like you don't have control over certain things, what can you do to help that? And that could be exercise, it could be meditation, or even gardening. Some patients, they love to go to the garden and plant some flowers and fruits and things like that. So there are little things that I think it's important for us to explore about our patients and talk to them about, and see if if that is a coping mechanism for them that we can actually exploit. And it's important that you really have the support system, the people around you who care about you, to help you through the process, help you through the first step of admitting that you're anxious or have other concerns, stress, depression, etc., and that support system to actually help you through it.
Let me jump on one comment that you made there that resonated with me a bit. Do you find that, and maybe I'll ask this of Dr. Maytal, do you find, Guy, that patients, particularly with a cancer diagnosis, their new identity becomes the diagnosis? That the person they once were now is just a patient that has cancer, and it's almost all-encompassing, and it's such an enormous thing to handle that day in, day out, you then, instead of focusing in on the things that Ghaith just mentioned that really give you calmness and stress reduction, you focus in on the things that are fear producing. What is your hemoglobin level? What's your platelet count? What does that bone marrow show? Am I progressing? Do you find that identity plays a big role in terms of how a patient can dissociate themselves from the actual disease that they have and become the person that they once were?
It's a good question. I think it's complicated. I'll answer it in a couple of ways. One is, it really does depend on how much anxiety played a role in your life before you had a diagnosis. Right? All of us, before, whether or not we have other physical illnesses, engage with life with some degree of anxiety on a spectrum from, 0 to can't leave the house because I'm terrified of the outside, which, by the way, is even more common these days with the pandemic. So wherever you were before, that's where, on the spectrum, that's where cancer lands. And so you're going to deal with cancer in a similar way that you'll deal with other things that are stressful and scary. The other issue is, where in the illness course are we talking? Because are you talking right at diagnosis when I'm trying to figure this out? I like to talk about a cancer diagnosis as you just got hired for a job that you never wanted, don't know how to do, and don't like. It's going to take a lot of your time. You're going to make a lot of mistakes. It'll probably cost you a lot of money, and you have to change everything for it. And at the beginning, like when you're learning anything new, it takes a tremendous amount of energy, time, focus. With something like MPN that's more chronic in nature, people accommodate over time. Just the nature of the course of it is, over time, they return to things that they enjoy, that they do, because you kind of have to. Life the earth keeps spinning, life keeps happening. You don't have doctor's visits every week. You maybe have them once a month, maybe you have them every other month. You develop relationship with your caregivers. So when they say, see at the beginning, they say it's going to be okay, you don't know whether to believe them or not. After a few visits and they say it's okay, and it turns out it is okay, the next time they say it's going to be okay, you go, okay, it'll be okay. The anxiety decreases a lot faster. So I think that's part of the unique nature of MPNs, is the chronicity of it, which allows people to return. And I really appreciate with Ghaith what you were saying. If I could just add, not just only what you enjoy, but how did you get through tough things before? Because everyone's dealt with tough things before. How'd you do it? Oh, why don't you bring that here and apply that here? So that's another way to do it. The last thing I'll say about it is, I think we have a hard time distinguishing between uncertainty, risk, and anxiety. Like uncertainty is just the state of not being certain. And we actually divide up the world into stuff we think we know and stuff we think we don't. Very few of us think about the real risk of driving in a car. Like there's a real risk of being injured or even killed in a car accident, but we don't really think about it. We just kind of get behind the car and drive. So then there are things that we think of as uncertain and scary, like going to the doctor's office for a blood test from an MPN. In the car, by the way. So that's the nature of uncertainty. And then anxiety is usually risk plus uncertainty equals anxiety.
Fabulous. Love the way you talked about that. I'm going to go back to you, if you don't mind,
Sure.
Dr. Maytal. Guy, can you just talk about a patient brought up the issue of I feel embarrassed to bring up the emotional feelings that I have related to this MPN cancer, perhaps diving into some of the things that Ghaith just mentioned. How should I ask for help, and who should that person be that I reach out to first?
The person you should ask for help, it could be anybody on your treatment team, whether that's your primary care doctor, your oncologist, the social worker. And the person to ask first is the person you feel most comfortable. That's what I always tell people. It may be your oncologist. It may be the nurse that you see every time when you're there, and they'll direct you. And you could start off just by saying, I'm a little bit embarrassed, but, rather than pretending you're not. Or I'm a little bit nervous, but, and I could use some help in talking about these concerns. Or if there are people in your life that are worried about you, you can use them. That's okay. Like my wife or husband or spouses, they're worried about me. They think I should get a little help and talk about this. Who should I want to make them happy. Who should how can we do that here? Right. And then whoever you're talking with might say, well, what's going on? And then you kind of tell them, well, they're kind of seeing this. Or you really find that person is easy to talk with and say, here's what's really happening, and I could use some help. And I find that it's kind of like there's no right way, there's no wrong way, just ask, and because we all communicate through email these days, sometimes if it's hard to ask in person, shoot an email and say, can we talk about this next time when we meet? So that, it's kind of it's out there, and then they'll bring it up, rather than you having to bring it up.
It's very true. Sometimes that in-person meeting is much more nerve-wracking than just sending a message to someone.
Yeah.
I think that's great. Dr. Abu-Zeinah, just on that line of conversation, what's the onus of responsibility on the practitioner, whether it be the nurse practitioner, the PA, the oncologist, et cetera, to really dive into symptoms? Because many times we're waiting for the patient to bring up this issue to us, right? Hey, doc, I'm feeling depressed. I'm feeling anxious. Every time I come in, oh my God, I just can't sleep at night. But what's the onus of responsibility on us, the medical team, to really dive in each and every visit to determine what the mental health struggle is like? And particularly, maybe even weave that into what's happened over the past 12 months during the pandemic. Has it been easier to bring up these discussions because the stress and anxiety and fear is palpable in everyone and is much more easily discussed? Or am I wrong about that?
Those are great questions, Jeff. Some of which I really don't know the answer to. What is the best way to do this? I will tell you that one thing that is clear to many of us, and if not all of us, is that what patients report as a symptom Like for instance, you give a patient a questionnaire and they write down their symptoms. And we get this, in the electronic records, we get a summary of patient-reported symptoms. And then we look back at our conversation, what we had in clinic, you ask a patient, how are you feeling today? Maybe 10, 20% of those list of symptoms come up in that open-ended question. So sometimes you really have to ask the question directly. Are you anxious? Are you depressed? But how do you ask that question? That's also, there's really, I think these questions should be asked in specific ways that make patients feel comfortable sharing. It's not certainly the first thing you start off with.
Mm-hmm.
So I think it's hard for both patients and physicians to approach this topic, but it shouldn't be. It shouldn't be as hard as it is. There's sort of an invisible barrier that is created often when we talk about, or when it comes to mental health issues. And Dr. Maytal had spoke about this very eloquently recently at our grand rounds. What can we do to break down that barrier so that there's open communication about how patients are feeling? And so I think the idea of sending an email beforehand, or, we have a version of that that's a little bit similar, sending a patient symptom questionnaire. And in MPNs, there's actually a validated questionnaire referred to as the MPN SAF. It includes several symptoms, of which some of them are mental health related. And so having that in advance sometimes might actually alert the physician and say, why is my patient reporting all these things, but we've never actually talked about them? So how can I prepare for that, and how can I bring that up and discuss it? And what can I do to help my patient if, whether it's something I can do or something I can get help from somebody else to do with me?
What's fascinating also, Ghaith, is that many of the symptoms that reference the MPN cancers also in that Venn diagram of symptoms cross over with what patients might complain of with depression and anxiety. And so it's challenging to figure out, is this related to the cancer that you had? Is it related to your low iron level because you've been getting phlebotomy a lot? Is it related to a depression? Is it related to anxiety? For instance, in my practice, where I'm not seeing MPN patients, I'm seeing all comers, I would say 30 to 35% of every single visit I see that is outside of the normal routine yearly visit, name the symptom, is derived in some way from an anxiety, from an anxiety that my uncle had that same symptom and ended up having cancer, or had a heart attack, or had some other issue. And so you have to, as a clinician, I really truly believe, no matter what the symptom may be, is tap into that. Take a second to ask that extra question of a patient to determine what their fear is and what brought them in the first place. Not just go through this algorithm of my knee hurts, how can I make it better? What's the diagnosis? Here's your medication. But also to understand, like, what is it that brought you in to see me today? And and quite frankly, the problem that we have in our medical system, and we can talk hours about this, is that the currency that every physician needs to be able to understand the psychosocial aspect and the emotional well-being of the patient that came in to see you is simple. It's time. And if you don't have the time to do it, you're not going to be able to do it, or you're going to be dissuaded from doing it. And so I would just say to any practitioner that may be listening out there, no matter what your discipline, is to try to figure out a way to have that time with the patient and ask that extra question, and assume that the symptom that the patient is coming in with may not be related to their MPN cancer, and it might be something a little bit deeper than that. And I really believe that that's something that if we educated both patient and clinician about, we'd have better outcomes in general long-term, particularly since this is a long-standing diagnosis and you're going to go through these peaks and valleys that we mentioned earlier. I'm going to switch gears a little bit for a second. Dr. Maytal, if you could just give me an idea of your thoughts on how patients self-medicate these symptoms away, and also discussing medications in general for a second, which is a taboo subject. If we think there's a stigma associated with mental health, or there's a big stigma associated with the treatment of mental health and the medications around it. But what I find that people do, and patients do too frequently, is they take the bull by the horns and they self-medicate their symptoms away. And they do so with substances, particularly alcohol. And so I just want to have you throw out some concepts and thoughts about how the patients that you treat are dealing with their own self-medication and how you combat that. And then furthermore, if you can just dive into a discussion of when does the anxiety and depression and stress require medication treatment?
Sure. I think alcohol or marijuana, it has somewhat of a generational divide to it. I find in my practice, people who are younger tend to lean more towards marijuana, and people who are older tend to lean more. It's obviously like any trend, there are obvious crossovers, but anytime you're trying to, the bottom line is certainly don't do it with alcohol, right? Alcohol is, not only does it worsen cancer, but it actually makes you more anxious long term. It might make you calm in the moment, but it worsens your sleep and it makes you more anxious. It's an anxiogenic substance. Marijuana is more complicated. For about 1 in 4 people who've never tried marijuana before, it causes some sort of psychiatric symptom. And you can't tell ahead of time who's going to have what. Anytime, I always get suspicious of any substance that's touted as a cure-all for everything with no side effects. Can't really be the case. And it isn't for marijuana, which isn't to say marijuana actually can't be helpful. For some people it is. We're engaged in a national naturalistic experiment where this substance is being approved state after state after state. It's not approved on the federal level. People are using it. There's growing data that it can be helpful, certainly with pain. For anxiety, the jury is still out. And I'm sure everyone listening, both patients or family members or clinical providers, either know from personal experience or know someone who has some positive anecdote about marijuana. So I think certainly alcohol for anxiety. Marijuana, it's complicated. You have to kind of have the conversation with your providers about it. You certainly don't want it to interfere with your treatment for the MPN. And you certainly don't want to be smoking it. I always say there's nothing that, no doctor is ever going to suggest smoke something as a treatment where there are fumes and, particulate matter. That's just, so the jury's out on that, but alcohol is completely bad for anxiety. In terms of when do you actually medicate anxiety? Listen, the way you treat anxiety is you turn down the volume and you learn to cope in new ways. That's like a simplest way I could say it. You can't learn to cope in new ways when your brain is on alert. Like, when you're in DEFCON 1 or whatever the highest is, I don't know which it is, 5 or 1. Whenever you're at the highest level of alertness, no one's going to say, all right, let's stop and think about new approaches to dealing with a life-threatening crisis. It just doesn't happen. What you're going to do is let me do what I've always done to get through it. So you can't learn new ways of engaging with life, to engage with other people, to engage with your own experience until you've turned down the volume of the intensity of the anxious symptoms. Or you can't learn new ways if you are so in the depths of despair because you just barely have enough wherewithal to get out of bed in the morning. The treatment for these conditions include both psychotherapy and medication. The best is some combination of both when they're severe enough. Some people say, I don't want to do medicines. I say, fine, start with therapy. The challenge, of course, is finding a therapist, navigating that world. It's very complicated. We can talk about that more in a bit. In terms of medications, what I think about is the syndrome impairing your ability to function in your life? If it is, then why not do something to have you function better? The thing I remind people is these medicines are not forever. Even as doctors, we forget that. One of the things I do a lot of as a psychiatrist is get people off of psychiatric meds. Mm-hmm. I think it's important to say depression or an episode of anxiety is just that, an episode. And when it's over, let's see if you can be off the medicine. And a lot of the time you can be. And if you can't, what I tell patients is, if what it takes for you to engage with your loved ones, do your work, have fulfillment and joy in your life, is putting a piece of chalk in your mouth once a day, then by all means, do the risk-benefit analysis and see what you think. And then most people kind of, when they look at it that way, because these medicines have such a haze or cloud of stuff around them, when for cancer, people are willing to take poison. And I'm saying take, a medicine like Prozac or Zoloft or something like that, that literally hundreds of millions of doses have been given out over 30 years, like completely safe, very effective. People are like, no, thank you. I don't do that. Would you like to take some platinum-based chemotherapy? Sure. So you have to remember where you are in terms of the significance versus the reality.
And I would say for the symptoms of MPNs, many of which are in that class of depression, anxiety, etc.
Yeah.
These medicines have a role, and they should not just be last resort. And I think a lot of people have that feeling. It'll be the last thing I possibly ever do, and suffer for months and years with symptoms without getting control on it. And I definitely agree with you. I think that the ability to find a therapist that you resonate with, who advocates for your mental well-being, is critical. It's the same thing that we talk about in the MPN community. This is not to disparage hematologists and oncologists in the communities throughout this country and throughout the world, but these are very rare cancers. And you would like to have experts in the field help to navigate that water with you. And I think the same is true with psychologists and psychiatrists, to be able to find that right person. And when the psychiatrist says it's time for medication, you're going to already have that relationship with them. And I think that's something that everyone could learn from, no doubt about it. We're going to ask a couple more questions, if you don't mind. One of them is going to be just related to the pandemic. I'd like to hear Dr. Abu-Zeinah's thoughts about this. Can you talk about the stressors that physicians have gone through? We've talked a lot about it as it relates to the MPN patients, and I'll weigh in here for a second as well, but there's just stressors that we have felt on the front lines taking care of patients.
Jeff, this is a tough question for physicians and healthcare workers in general, who are really held up to the standard of being the heroes during the pandemic. We have to be strong. We have to be emotionally and physically strong for everybody around us, right? If we're not strong, then who will be? So, I will not shy away from admitting that this past year was both mentally and physically draining. To me and a lot of my colleagues and even my family who are actually in healthcare. It was more so a mental than a physical challenge, I think. It is the anxiety and the fear that me being in the hospital treating patients with COVID-19 puts me and my close contacts and loved ones, including patients, of course, at risk of getting ill. What I think got many of us through, at least I can speak on behalf of myself, what got me through this is a reminder every day that I'm still here. I'm fortunate to be in good health, surrounded by wonderful people and colleagues, still seeing my patients. And there really is a tremendous positive influence that you get from being around colleagues who go through the same experiences and are not shy to voice their fears and frustrations. So really being in this circle where you're able to talk to somebody about it has been tremendously helpful for many of us. And beyond that, our hospital has the access to mental health professionals that we can reach out to as physicians too. So those of us who feel a certain way, they should be able to tap into that resource and be able to discuss how they feel, and they can get the help when they need it and if they need it.
No, I fully agree with that. Here locally at my hospital, myself and some other physicians formed a wellness committee to really tackle a lot of these stressors that we have. And I think it's analogous to what a patient listening right now should do. They should form their own wellness committee, which basically means team up with other MPN patients, meet them, get on Facebook. There are groups everywhere that talk about P-Vera and ET and myelofibrosis and other MPNs, and learn from one another. The beauty of this disease is that many people, most of us, are going to live a very long life. And what does that allow us to do? It allows us to impart knowledge of what we've been through, of the side effects of medicines, of the fears of the bone marrow, of the physicians that we really love, going through these journeys together and being able to impart that knowledge to somebody who's newly diagnosed, no matter what age they may be. There's power in that. There's comfort in that. That takes down the level of stress and anxiety significantly. We see that in the wellness committee here at my hospital, and I would encourage everyone that's listening to find their own ways to cope, whether that's individually with meditation and yoga and exercise and sleeping right and decreasing substance use, and reaching out to family and friends and being unafraid to tell them and bring them into what you're going through because they want to help and they're there for you and you want to destigmatize this disease for them. And so I think that this is a moment in time. There's some reason, if you're watching tonight, that the title MPNs and mental health resonated with you and you wanted to learn more. So if that potentially is because you've been suffering in silence and not talking to someone about it, now is the time to come up with a strategy and reach out to the right people and be really unafraid and courageous at wanting to feel better. And I think we all deserve that. I'll give both of you just a moment to give your wrapping up thoughts on tonight's broadcast. And certainly if people have interest in continuing this conversation, please reach out to us, go to the CR&T Fund website, ask questions of us. I'm more than happy to put another event like this together. I've learned so much from both of you tonight, but perhaps Dr. Maytal can start and just give us a quick overview of some of the lasting notes that you want patients to take away from tonight's broadcast.
Yeah, there's really one thing I want patients to take away with is that there is nothing abnormal about having difficulty in life. To be human is to need other people. And if you are struggling, dealing with things that are beyond your capacity or suffering in some way mentally or psychologically or emotionally, just ask for help. It's there, it's available, and there's really no reason to suffer.
Thank you so much. Ghaith, what are your thoughts?
I would echo that. I think you, as a patient, even as a physician, you really have to admit if you're feeling a certain way and you need help, you have to admit that you need the help. I think that's the first step, and then work through with a team of people who care about you, whether medically, professionally, or as family relatives, to help you overcome some of those feelings and really improve and maintain your mental well-being, which is a very, very important part of the journey of healing from having these diseases.
Guys, thank you so much for tonight. I really appreciate it. Dr. Abu-Zeinah and Dr. Maytal, you've both been fantastic at illuminating the need to speak out, identify the struggle that you're going through with MPN cancers and getting the help that you deserve and feeling better. Because clearly, anyone that takes that step is going to feel better. You'll find the right person, you'll find the right strategy, and don't be afraid to reach out. Thank you again to the CR&T board, to the CR&T members, to Dr. Silver, Tom Silver, Barbara Rosenstein, David Boulay, and to everybody else that made tonight happen. I really appreciate it. We look forward to continuing this webinar series in the future. And once again, guys, thank you so much for your time tonight. It was really fantastic.
Our pleasure.
Jeff, and thank you, Dr. Maytal.
Great.
Thank you both.